Welcome back, Mary Rose. Good to see you.
Good to see you too.
My name is Dr. Luna, and I'll be doing your head-to-toe medical assessment today.
Okay.
Anything in particular bringing you in?
I've been having some headaches recently.
Okay.
Yeah.
When did these headaches start?
They've been going on for the past couple months.
Okay. And on a scale of 1 to 10, how intense are they?
I'd say 4.
A 4. And where are they localized?
Sort of towards the front here.
Okay. Right. Are you on any new medication?
Nothing new, no.
Okay. Any blurred vision or double vision when you experience those headaches?
No.
Anything else going on with you that you think I should know about?
Like recently or in the past?
In the past year or so, has anything changed in your medical history?
I have started taking vitamin D supplements. I had some blood tests done and the levels were low.
And when did you have those blood tests done?
I believe, November.
Are you taking any medication?
Yes.
Okay, so maybe just over-the-counter vitamin D supplements?
Yes.
And how often are you taking those?
The vitamin D supplements I take once every day in the morning.
And do you remember the dosage?
I don't, I'm sorry.
Probably somewhere on the order of 100 micrograms to 200, which is the typical over-the-counter dosage.
That sounds right.
Anything wrong with your heart, lungs?
Yes, I do have a heart murmur.
A heart murmur. Okay. And when were you diagnosed with this condition?
Since birth.
Okay, so it's a congenital disease.
Yes.
Okay. Congenital condition. Do you know if anybody in your family suffers from this as well?
My mother.
Okay. So from the maternal side, how about your grandmother?
I think she did too.
Okay. Are you under any special treatment or medication for this condition?
I do take medication for it.
Okay. And what sort of medication are you taking?
Eliquis.
Eliquis, okay. Do you remember the dosage?
I think it was 5 milligrams, and I take that once in the morning and once in the evening.
Any heart palpitations that are so strong that prevent you from doing just your regular life?
No.
No. Okay. Any night sweats?
No.
Okay. So I'm gonna go ahead and put on my medical gloves. And I'll start off by taking your vital signs first. So we have a nice baseline. And I'll make sure to focus on your heart, your lungs, your chest, as well as do a neurological assessment. Okay, so I'm going to start off by listening to your heart. Are you in any pain right now?
No.
Okay, is it okay if I remove your hair from the side of your chest? Good, so go ahead and just breathe normally. And I'll be looking for any murmurs. Okay, I'm hearing S1 and S2, which is good news. And I am hearing a little bit of a murmur, which is consistent with atrial fibrillation. On a scale of 1 to 10, I would categorize it on the low 2. And no other extra sounds other than the murmur in the lower chamber. Okay, so definitely the medication is working. Continue taking it. All right, I'm going to focus on your lungs. Take a deep breath in and out. Okay, deep breath in. Okay, can continue breathing normally now. I'm also going to listen to the base of your lungs. Okay. Deep breath in and out. Deep breath in and out. Okay. And deep breath in and out. Okay. The base of the lungs is clear. Wonderful. So I'm going to make a note of the auditory characteristics of that sound. Okay, low twos, lower chamber, mild sound consistent with atrial fibrillation. Okay. Good. Alright. Going to take your temperature and verify the levels of oxygenation. Next, may I please have your index finger? Perfect. Alright, we're gonna let this rest right here. And I'm going to use my thermometer, and it's going to go over your forehead and behind your ear.
Okay.
.3, so you do not have a fever. And 99% oxygenation, 80 beats per minute. Those are excellent vital signs. 98.3, 99 oxygenation, 80 beats per minute. Okay. All right. Next up, I'm going to check your pulse, and I'm going to do it on a couple of different locations. Right here by your carotid artery, brachial artery, and radially. Okay, so just breathe normally. Okay. Good. So the pulse is normal, not hyperdynamic, and symmetric. Going to check your reflexes next and tap on the bony prominences of your body, and I'm looking for any reactions that are abnormal or any neurological signs of spinal nerve damage or anything abnormal.
Okay.
Okay. So I'm going to start off with your head. Top of your head. Good. Okay, let's check your reflexes. Okay, good. This one. Good. Okay. Good. Next up, I'm just going to take a couple of measurements. I will start off by checking the circumference of your head and then checking for overall body symmetry. Can you please
Yes.
your arms just like that? Elevate them. That's 72. 72. Perfect. Okay, you can lower your arms now. Circumference 52. Left arm and right arm symmetric. And head proportion is normal. Okay. So next up, I'm just going to check your head overall for any lumps or bumps or any abnormal pain.
Okay.
Have you noticed any lumps on your body anywhere that you would want me to check them out?
I don't think so.
Okay, good. All right. I'm also looking at your scalp and your face. Checking the mastoid bone process behind the ear. Any pain here?
No.
Good. And I'm going to check your head from behind as well. Any pain when I apply pressure?
No.
And how about now?
No.
Okay, good. Okay. I'm gonna check your lymph nodes. Occipital lymph nodes in the back are normal. I'm gonna check the mandibular, preauricular, tonsillar, submental, and then cervical down the neck. And your thyroid. Checking for any nodules. Thyroid is barely palpable. Can you swallow for me? Okay, moves up and down as expected. Checking your supraclavicular lymph nodes. And pectoral and axillary. Okay, good. Okay, so lymph nodes are normal, head is normal. I'm gonna go ahead and focus on the eyes next. Okay. So no blurred vision, no double vision. Have you noticed any extra dryness or irritation with your eyes?
Not that I've noticed.
Good. Okay, go ahead and look into the distance for me. I'm going to check your pupil response. Good. 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 And now go ahead and look at my nose. Good. Perfect. Pupils are round and reactive to light. Accommodating. Size and shape is normal, about 2.5 millimeters. Perfect. All right, let's go ahead and do a quick eye exam. I want you to cover one eye, and I'm going to mirror you. And now tell me how many fingers you see me holding up.
2.
Okay, great.
1.
Good.
2.
Okay.
1.
Good. Let's go ahead and do the same with the other eye. And look into my eyes.
2.
Good.
1.
Good.
1. 5.
Perfect. So peripheral vision is intact, no concerns there. All right, let me go ahead and take a couple of notes. Do you usually wear glasses or contacts?
Sometimes I wear reading glasses.
Oh, God. Do you know the numbers on those glasses?
I'm not sure.
Okay. So let's go ahead and use the Snellen chart. And I want you to hold this away from you in your hand. It needs to be about an arm's length away. And you can lower it a little bit. Yes, good. And now can you tell me what this letter is?
E.
Okay. How about this bottom row? Can you read it from right to left?
H, P, F, T, L.
Good. And what color is this?
Red.
And this one?
Green.
Okay. And can you read this number over here, the first one?
2.
Perfect. Okay, so no concerns with your eyes. All right. I'm also going to check the back of your eye, the fundus, and I'll be looking at the retina and evaluating the macula from a physiological point of view. So I'm going to use my ophthalmoscopy here and turn it on, and you can look into the distance for me. I'm going to try to get a clear view of your eye. Perfect. Then I'm going to get really close and okay. So optic nerve is intact, good ratio. Macula looks healthy. Good, no concern there. Gonna do the same on the other eye. Okay, perfect. Can you look up for me? Down, left, and right. And now look right into my device. Perfect, good. So optic nerve is intact. Can you look up for me? Just gonna take a peek at the conjunctiva and sclera. Good. The fundus of the eye is healthy. The arteries look good as well. Sclera is white. Conjunctiva is pink and moist. And no concerns, no signs of any irritation. Good. Okay. So next up, I'm going to check your ears. Have you noticed any abnormal sounds, any tinnitus?
No.
Okay. Go ahead and look towards your left. I'm going to look at the outside of the ear first. No discharge. The auricle of the ear looks healthy. Okay, so I'm going to take a peek inside and you're going to feel the tip of my otoscope here going in slightly.
Okay.
Okay. I'm seeing a little bit of wax build up, but not too concerning, within normal amount. I'm seeing all the bony landmarks present. Cone of light is present. Tympanic membrane is pearly gray. And I can see it clearly, not inflamed. Good. All right. Let's evaluate this ear as well. The exterior looks healthy. Do you feel any pain when I pull down?
No.
Any pain when I pull up?
No.
Good. Okay. Okay, I have a very good view of the tympanic membrane, pearly gray. Good margins. Cone of light is present. No inflammation. Excellent. So let's do a quick hearing test. This is a tuning fork, and I'm going to strike it and cause a vibration. And I'm going to put it in two positions in your ear, and I want you to tell me which one is louder.
Okay.
1 or 2. Okay. So let's start with the right ear. This is position 1, position 2.
I think position 1.
Okay, very good. Okay, position 1, position 2.
Position 1.
Good, perfect. Okay. So I'm going to focus on your nose and your mouth next. And I'm going to start by palpating your nose. Any pain or any discharge from your nose that I should be aware of? No. Okay, very good. You can close your eyes. And just let me feel the outside of the nose. Bridge of the nose is straight. Any pain here?
No.
Any pain here?
No.
Okay, take a deep breath in with one nostril closed and out. Perfect, unobstructed. Deep breath in and out. Good, unobstructed. Okay. Right. I'm going to give you something to smell and try to identify the smell.
Lavender?
Lavender, perfect. Okay. Good. And I'm going to also check the mouth next. Go ahead and stick out your tongue. And I'm going to take a look inside. No signs of any inflammation. The pharynx looks good. No signs of pharyngeal erythema. And not seeing the presence of a lingular thyroid. Okay. So, eye exam, no positive findings. Mouth exam as well. Good. All right. Next up, I'm going to take a swab of the inside of your mouth, and this is just standard procedure. I'm going to check for just the common viruses or bacteria. Okay. You can open your mouth for me. That's one. And then the other one. Good. So I'm going to be sending this to the lab. And we'll get the results in a couple of days. Good. Okay. Next up, I'm going to do a couple of different sensation tests on your face, on your chest, your arms, and this is just standard neurological checkup to make sure that there's nothing going on with the nerves in your body. Okay, so first I'm going to start with the sharp or dull test. May I please have your palm? Okay, so this is dull. It's very soft. And this is sharp. So it's more localized than pointy. So go ahead and close your eyes and tell me if you feel sharp or dull.
Dull.
Okay, good.
Sharp.
Okay.
Sharp.
Good.
Dull. Dull. Sharp.
Good. And now I'm going to be touching you with something cold. And I want you to tell me if you feel it on the right side of your body, anywhere on the right, or on the left.
Okay.
So yes, keep your eyes closed.
Left. Right.
Okay.
Left. Right.
Okay, so I want you to pay attention to the cold sensation.
Right.
Good.
Right. Left. 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 Right. Left. left.
Good. So no positive neurological findings. Able to distinguish between sharp and dull, and two different types of sensations, just pure touch and the cold sensation. Okay, very good. All right, next up I'd like you to lay down, and you can put this medical gown on, and I'm going to check your tummy and your legs and your feet.
Okay.
Okay. Is it okay if I unbutton your gown?
Mm-hmm.
So I'm first going to do a visual inspection. And make sure I'm not missing any obvious signs of masses or lumps. Okay, good. I'm also going to check for any lesions or indentations on the skin. You have one mole, which looks normal, one color, slightly raised. No other signs of any indentations. Okay, good. I'm going to ask your date next. Okay, I'm hearing a normal amount of activity. I'm going to check all the 4 quadrants of the abdominal cavity. And paying attention for any swooshing sounds that may not be in line with just normal activity. Good. I'm not hearing any of such things. Okay. Good. All right, I'm going to do a light palpation next. And a deeper palpation around your stomach, checking for the size and shape. Okay. And I'm also going to check your liver. Good, the tip of the liver is barely palpable. The spleen size is normal as well. And I'm going to check your kidneys. Okay, take a deep breath in for me. And now exhale. Okay, good. Perfect. Okay. Going to measure your belly button and check for symmetry. 1.1 and 0.1. Okay. And I'm also going to check the dermatomes on your abdominal area. Go ahead and say yes when you feel a cold sensation.
Yes.
Okay.
Yes. Yes. Yes.
Okay. And I'm going to cause a vibration. I want you to tell me when you stop feeling it.
Okay. Stopped.
Okay, let's try again. Do you feel it?
Yes. Stopped.
Good.
Stopped.
Okay. Do you feel it?
Yes. Stopped.
Okay, very good. And is this sharp or dull?
Dull. Dull.
Good. How about this?
Sharp.
And this?
Sharp.
Okay, very good. Okay, I'm also going to take a couple of measurements of your upper body and check for symmetry. 20, 10, and from the belly button to your shoulder, 44. From the belly button to your right shoulder, exactly 44. And 9 and 24. Okay. And do you feel this?
Yes.
And how about this?
Yes. 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 Yes.
Very good. Okay, I'm going to button you back up and I will take a look at your legs and feet. Okay, so let's take a look at your legs and your feet. Checking for edema. Just be touching and seeing the skin response. And then palpating. Okay. No signs of any edema. Okay. I'm going to check the pedal pulses. 2+, synchronized. Good. We're going to do a couple of strength tests. I'm going to try to spread your legs apart. Don't let me do that. Perfect. I'm going to attempt to raise them. Don't let me do that. Good. And now I want you to push with the heels inside my palms. Good. Perfect. And now I want you to raise your right leg only. Good. And lower it. And then your left leg. and lower it. Perfect. Okay. Can you curl your toes around my finger? Perfect. And let's try with your right foot as well. Good. And can you wiggle both of all your 10 toes? Good. Okay. I'm going to take a couple of measurements, checking for overall symmetry. Checking your ankles for any inflammation. So they're symmetric. Okay, I'm going to palpate the plantar region. Good. Okay, no pain is indicated. I'm going to check the nerves in the plantar region of your feet. Do you feel this?
Yeah.
Okay, how about this?
Yeah.
And this?
Yeah.
And this?
Yeah.
This?
Yeah.
Is this sharp or dull?
Sharp. Sharp. Dull. Sharp. Sharp. Dull.
Good. All right. I'm going to check your toes and your fingernails and check for the capillary refills. Okay, 2+. Good. Good. So everything checks out. You can stand up now and we can discuss the results. Okay, Mary Rose, so this concludes the assessment for today. I'm going to take a couple of notes of my observations, making sure that your chart is up to date. So the abdominal assessment showed no positive findings. Eye head exam was normal. Have you been taking any medication for the headaches?
Every now and then I'll take like Advil or ibuprofen.
Continue taking those. I'm not going to prescribe anything stronger unless the pain becomes, much more than it is today.
Okay.
We usually don't want you on any strong painkiller medication. Can be very toxic to the liver. Okay, legs and feet were normal. No signs of any neurological disorders. I would continue taking the heart murmur medication just like you have been. The heart exam, cardiovascular exam showed no concerns whatsoever. So as of right now, I consider you to be, to have that condition under control. Okay. Do you have any questions for me after the exam today?
I don't think so, no.
Okay, great. Patient had no follow-up questions. So I'd like to see you again in a couple of months to make sure that the murmur hasn't progressed in any way, hasn't changed any of the sound characteristics. And other than that, take care of yourself and I'll see you soon.
All right, thank you so much.